Hello, my name is Alex Steinberg. I'm Hello, my name is Alex Steinberg. I'm Director of Plastic and Reconstructive Surgery at Kings County Hospital. Today, I would like to show and familiarize our audience with the work that we do at Kings County and specifically at Plastic and Reconstructive Surgery Division. And with that, I would like to proceed with the presentation that I prepared. And just to bring a little bit of historical perspective, Plastic and Reconstructive Surgery Division at Kings County, together with residency, was one of the plastic surgery entities in New York City, which was started in late 1940s and early 1950s. That was the first plastic surgery residency in New York. In 2014, right before I came to Kings County Hospital, unfortunately, the division was reduced to only one surgeon, and there is no plastic residency right now, and the case volume was slightly over 70 cases at that time. Within 3 years after the time that I became a director of the service, I was able to increase the case volume to over 100 cases, and in first half year of 2019, we were on projection to deliver over 120 cases, which would account to 91 or more than 90 individual procedures. And that was our projected plan in 2019. So right now, I am Director of Plastic Surgery Service since 2015. And within that period of time, I was able to, just showing on the graph, increase the case volume as showed here. I recruited one of the medical students to do research fellowship activities, and we were able to produce papers. We also introduced plastic surgery elective rotation, which now encompasses maxillofacial residents, downstate medical students, PA and NP students as well. We also support Plastic Surgery Club, and we deliver publications and presentations. This is one of the most recent presentations, which was showed at Northeastern Society of Plastic Surgery 2 weeks ago, and we presented our protocols for management of the keloids. We are high case volume service, and we also do have high demand on our procedures. So right now there is over 70 patients waiting for surgeries. So we have several months wait list going forward. Breast reduction has been on a very long wait list right now, up to now, but since about a year ago, we recruited a new plastic surgeon, Dr. Bahulian, who is aggressively taking on reducing our deficits and reducing our wait time, and she is actively performing breast reductions, and our wait time is reduced significantly to probably just a few months. We used to lose a lot of patients because of prolonged wait time, and bariatric cosmetic cases and wound management cases used to be re-referred to other institutions. And again, now with addition of new surgeon, Dr. Bahulian, we are capturing those cases and keeping them at Kings County. While looking at the service we provide and organization of the service, we looked at organization and utilization of the operating room, and we identified that there was a significant number of surgeries which are done under local anesthesia and do not require main operating room time. Up to recent time, about a year ago, we used to do all surgeries in the main operating room, and 40% of cases were able to be moved into the non-main operating room location. So this shows our case volume, which was during the prior years before the COVID. We were reaching about 120 cases a year, and those cases incorporate mostly breast reconstruction surgeries for breast cancer patients, since this is high priority patients and we serve very large population who requires breast cancer treatment. We also manage variety of scars, variety of infectious conditions. We perform abdominal reconstructions, skin grafts for burn and wound patients. We do resect tumors and reconstruct the wounds, as well as perform significant amount of breast reductions and smaller amount of cosmetic cases, which include facelift, blepharoplasty, rhinoplasty. And this is just a different way to look at the case volume and procedures. Again, with breast cancer occupying majority of our time, since this is high priority patients, and we try to satisfy their needs as soon as possible. How our service is getting supplied by referrals is shown here. We work with multiple of different surgical services, which includes breast surgical oncology, burn and wound services, orthopedic reconstructive services, aesthetic and cosmetic surgery, which right now done mostly for patients who had surgery somewhere else and need additional work. We work with surgical oncologists and help to reconstruct wounds after their surgeries. We work with general surgeons, bariatric surgeons specifically. There's a new program which created high demand on body contouring procedures. Dr. Bahulin is specializing in performing surgeries related to post-bariatric management, and her procedures include abdominoplasty, body contouring and reshaping of the abdominal wall, brachioplasty, thighplasty, and breast lift and reduction or gynecomastia procedures for the patients who lost a significant amount of weight. And trauma and reconstructive surgery is not the last one, but one of the main referral basis for our service. So the main bulk of our procedures, again, is concentrated on breast cancer patients, since these patients need services quickly, and it's very important for their healing and recovery process and for their psychological state. We perform all three variety of breast reconstructions, which include oncoplastic reconstructions for patients who have partial mastectomy, and we use the remaining of the breast to reshape and make it look like a natural breast. We use prosthetic reconstruction for patients who have total mastectomies, as well as autologous reconstruction while using the patient's own fat and skin to reshape and restore breast. In addition to breast reconstructive services, we see high demand on procedures which coming from community doctors, and those procedures include breast reduction, keloid scar treatment and management, post-bariatric surgery procedures. Again, those now we are creating in-house since we have bariatric division, so there will be significant demand on body contouring and reshaping procedures for patients who lost significant amount of weight. And again, Dr. Bahulin is concentrating on those procedures. And also cosmetic procedures, which right now tend to go to different states or even different countries. And we unfortunately end up taking care of only complications for those procedures. But those procedures also could be done at Kings County. The benefits of plastic and reconstructive surgery division is broad. It includes high volume of cases. We tend to have high demand on our procedures, and we currently have significant wait time, which confirms that as a result of high number of cases, that leads to high revenue for the hospital. And as a result of that, we are trying to recruit those revenues to provide more additional services and to provide better services and increase patient satisfaction. Looking at the competition, there are no other hospitals in Brooklyn which have comprehensive plastic surgery department or division, which would take care of cancer reconstructions, burn, cosmetic patients, body contouring for weight loss patients. Patients with advanced requirements for procedures tend to get transferred from Brooklyn to bigger institutions in Manhattan, And again, we can provide most of those services here at Kings County. And patients who are looking for cosmetic surgery are trying to go for more price competitive locations, which tend to be out of state or in different countries. But when they come back, if they have complications, they end up coming back to Kings County, so we can restore and fix the issues which arise from surgeries which are done sometimes not in the most optimal environment. Several years ago, I developed the plan to grow and widen the services that Division of Plastic Surgery can deliver, and I divided in 3 stages. First stage included getting second plastic surgeon and getting dedicated physician extender, and we are successfully moving through this stage. We now have second plastic surgeon, Dr. Bahulian, who again is concentrating on body contouring procedures. We are still working on getting physician assistant, which is dedicated to plastic surgery, and this is work in progress. The second stage would be getting another plastic surgeon, since we do have very high volume of cases, and we're expecting to increase this volume and demand, since we have now bariatric program which creates additional patient volume. With that, we will need additional support, and we would get probably second or maybe even third physician extender or nurse practitioner. And if we're successful with getting and growing our services, growing the number of providers, growing number of supporting staff, I think we're well situated to reopen plastic surgery residency, which was one of the first residencies in New York State. And also, Kings County used to have a burn center, which I'm personally very interested in, since I do have burn training, and Brooklyn, which is the biggest borough in New York, doesn't have burn center, and that's one of the deficiencies which we can try to correct by potentially having burn center at Kings County Hospital. Again, just to recoup, we are moving through stage 1 right now with another plastic surgeon, working on dedicated plastic surgery physician assistant. We are working on getting dedicated space where we can have environment which is appropriate for plastic surgery patients, and for management of the pre-op and post-operative patients specific to plastic surgery. And with all those incorporations into and advancement in our services, we would be looking into increasing our case volume. This just shows what we did in the past. We separated our cases from the main operating room to smaller cases which are done in the procedure room right now. We can at least double the volume of the cases by just shifting around where we do our surgeries, and with addition of another plastic surgeon. This is just a representation of what I think is achievable and projected with our innovative approach in separation of the minor and major surgeries, and addition of another plastic surgeon. And just another view of where we are right now and where we can be with continuous work on improving efficiency and delivery of surgical care. With stage 2, we would move to increasing number of surgeons, increasing number of physician extenders, and also getting administrative support, which will smooth out the interaction between the different divisions, different departments, and delivery and follow-up of the care related to Division of Plastic and Reconstructive Surgery. That would be the structure that I envision would be functional to support high volume active plastic surgery division. With development of more activities, we look into organizing our clinical duties into 2 full block days in the operating room, which would double our current block time. We would look into getting 2 full plastic surgery clinics per week, which right now we only have 2 half days. Again, it would double ability to double the volume of patients we can see during the clinic times. We already provide 24/7 coverage for the emergency room consultations, and we do have rounds, but we can extend it to daily rounds on the wards. We also involved in the teaching and education, and our goal is to reach weekly didactic conference, have monthly journal club, and monthly research activities. Right now, we have bi-weekly interdisciplinary education conference. We invite members of other surgical divisions as well as members of non-surgical divisions to come to our indication conference, which is on Thursdays at 12 o'clock, E-Building 9th floor. We discuss upcoming cases. We would usually prepare them several days before. We would contact services which are willing to come and join us in the conference, so we can make it educational, and also it helps to prepare for surgeries and brainstorm different options and provide better care for the patients. And just looking back in the grand scheme of what we are looking to do, stage one, we are partially through stage one of development of the plan that I developed. We have second surgeon, we have physician assistant who right now is part-time, but we're looking into full-time dedicated physician assistant in plastic surgery service. We are looking for dedicated plastic surgery office space and clinical space, which will create appropriate environment to deliver high volume, high quality care. And we are already involved in teaching and research, which we're looking to develop even more. Stage two would include getting another plastic surgeon, extending our physician extender support, and increasing operating room and clinical hours in the clinics. And with stage three, I think again it's a long-looking plans, maybe 10-year plan. If we have volume academic activities and supporting staff activities, it will allow us to develop teaching program, which again has precedent being at Kings County, and I think we can restore it and develop it to a higher level. And having burn hyperbaric wound center would be also integral part to delivery of care as well as education. And Brooklyn, the biggest borough, does not have currently proper burn and wound center. And with having all the services, even right now, which we are able to achieve high satisfaction. This is reviews from the patients, and patients are happy with what we giving to them, how we're taking care of them. We have many 5-star reviews, and these are reviews which are posted on Google. And to recoup what plastic surgery division department can deliver for Kings County is high volume of surgical cases, which will translate into higher revenue to the hospital, into the system. And I hope by delivering higher revenue, we can reuse those revenues to increase satisfaction and improve care for our patients here at Kings County. And this is the conclusion of my presentation, and I would like to take questions if there are questions at this time. If there are no questions, we will conclude our presentation, and you are welcome to again come to our indication conference and join us in the clinic, or contact me through Department of Surgery, contacting Department of Surgery and asking to reach out to Director of Plastic and Reconstructive Surgery, Dr. Shteynberg. I will be happy to return calls or emails or any other ways of contacting. Thank you very much.